everybody. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have with me the Dr. Jacob Dent. This episode is sponsored by Rarebird Speakers, where you find the best speakers in the industry, also their speaker training. So check out the website at rarebirdspeakers.com. Welcome to the stage, Dr. Dent. So nice
Morning,
to
Kelly.
have you.
Thank you for having me. I appreciate the time.
Yeah, so you guys, Dr. Dent, I just told him before we got on that every time I meet with him, I just adore him even more. I talk with him every week for speaking engagements and things, but I mean, look at the sweater and look at the pink flamingos in the back. I mean, how can you compete with this guy? He's memorable for sure, and he's like that as a speaker too, aren't you?
We try to leave everybody with a good impression, when they come and listen to us talk.
Yeah, that's right. We always start with a question, Dr. Dent. Why dentistry for you? Did it choose you? Did you choose it?
No, it's actually funny because most people ask me, "Did I become a dentist because my last name is Dent?" And I jokingly tell them it was either this or car repair, and, I preferred the air condition, versus outside. But no, there's no dentist in my family. Most of my family's all oil and gas, and, it started back when I was in high school. I had a chemistry teacher that made the comment, "You have really steady hands," when we were mixing, chemicals and stuff in class, and so it kinda got me to thinking about a career, in dentistry or medicine, and, when I went to college, I worked for a company that, supported nursing homes, with therapies, and my job was very simple, just to go get things signed, um, consents, etcetera, and I realized quickly in that job that, I had a aversion to sick people, and I figured I couldn't catch a cavity, so I was like, "Well, let's try dentistry." And kinda went from there, but, yeah, dentistry's been, an amazing career. I've had opportunities that, this career has afforded me, including things like this, which I never thought possible back in the day before I even went to dental school.
That's, so what I heard you just say is that a lot of where your decision making started from, other than your last name,
Right.
was someone said to you, you had a steady hand.
Yeah. Yeah, that's exactly where,
Small passing comment stuck with you.
yep, yep, I can remember it was Miss Bro at at high school, junior chemistry.
Hmm. Well, and then you so then not medicine because you couldn't cope with the sickness, and then did you when you graduated from dental school, did you go out into specific settings? Did you go right into private practice? What was your story there?
Yeah, I've got a very unique, first 2 years of practice. So got out of dental school, and I was actually planning on moving to Texas, to start a practice there, and, um, and that fell through, like, last minute. So then had to make an abrupt change, got back to Louisiana, and, worked for a group practice, private group practice for about 7 months. Um, didn't get along with the owner, and then decided it was time for me just to own my own practice. So, I bought a practice that had been shut down for a couple of years in a rural little town called Creole, Louisiana. I was the only dentist for 45 miles in any direction, and, it was very, Mayberry, as I tell 'em. It was very small, everybody knew everybody, and, exactly a year and 4 months after I opened, Hurricane Rita ripped it off the slab, and completely destroyed it. So, at that point, I'm less than 2 years into practice, got all this debt from just building a brand new office and, uh, just have, nowhere to go, and which ironically, it led me back to going to Texas. So I moved the family, went to Houston area and, started practicing there, and I did that for the next 14 years until I decided to move back to Louisiana.
Wow. What a story. Did you have insurance on your practice? Did it cover any damages with that?
I did, unfortunately, the way that it worked out, we were we were only given 50 cents on the dollar, just based off of they said that there was no wind involved in a hurricane. Um, that's the way that the, insurance
What?
screwed us over, yeah, no. So they paid us the flood, but not the wind, needless to say, it was a good life lesson, but, you know, fast forward from that, to 2016, and I opened an office in Baton Rouge, and, less than 3 months after I opened it, the levees broke in a massive flood and flooded the whole thing, and that one wasn't in a flood zone, so, that was my I think I'm the only dentist in Louisiana that's lost 2 offices to natural disasters.
That is nuts. And so
Yeah.
then what?
Then pick yourself up and dust yourself off and start again, you know?
Yeah.
You do what you gotta do, but,
Learn a lot about yourself during that time, don't you?
you do, you learn to build on higher ground, that's for sure, or farther away from the coast.
Well, literally and figuratively.
That's right, that's
So
right.
you care for folks with special abilities. Talk to the audience a little bit about how that came into your life and how that's led you to what you're doing now.
Yeah, it really just all originated from, my son, Ethan, who's 21 now, but at 2 years old, he was diagnosed, as moderate autism, and that took me down a path, that I never expected. I had no training for, no idea of what I was dealing with, and that's personally. Professionally, I had even less knowledge around caring for people with special needs. Um, Unfortunately, when I was in dental school, special needs care was not part of our curriculum, unless you went and specialized in pedo or,
Right.
GPR, just and that's standard, this was back in 2003, so that was very standard, and so, really, I had no expectation, no, plans to ever, do what I'm doing now, but, as they say, the blessings that came with um, the autism diagnosis was, it forced us to realize how much need was out there, as well as how much ignorance was out there on our part, on my part, but also from the dental side, how little I knew and was trained in treating patients with neurodiversity and neurosensitivity.
Yeah, because they only have so much time in a dental curriculum.
Oh, absolutely, yeah,
And then that I think that's to your point where they say, "Okay, when you specialize in this, if you're interested in it, if you happen to be interested," but and I know that you know this more than you're more sensitive to it than a lot of us is that so many more even adults and children are being diagnosed with autism and being, uh, that these things were underdiagnosed for a long time, they were explained away. And so the everyday dentist and hygienist and dental team member has no idea how to even recognize. So it's kind of like it just came to me, a person that you're seeing changes in the mouth, right? And you're recognizing that something's not quite right here, that we can be that first responder to that to say, something is not lining up here. Have you ever thought about this? Have you ever been tested for this? To be that advocate for that patient,
yeah,
to, to kind of bridge some of those pieces because some people just think that they may have a learning disability or that they just can't pass tests or that and it was before any of that testing was around.
yeah, yeah. A lot of what I find to be more and more evident is that when I teach classes on special needs, we honestly, I get a lot of hygienists because hygienists are usually the first, person that the patient sees in the dental office. and the dentist is, last to come in and do their exams. So I see a lot of them very curious about special needs. But one of the things that we're working on right now is making sure everybody understands, dentist, hygienist, whatever. Um, you are actually already a special needs dentist. You have more training than you think because you see patients with anxiety, with depression, with sensitivities to a dental exam or cleaning or treatment, and we don't think anything about those patients um, because we assume that they're just dental anxiety, and how do
Yeah.
we treat that? Well, we give them laughing gas or give them nitrous, or so we're already in the world of special needs. And one of the things I try to explain to those that may be a little hesitant in getting into opening their doors to patients with autism or Down syndrome or any form of medical complexities, it's understanding it's not the teeth. The teeth are the easiest thing that we deal with. We're scared of the person behind the teeth. We're scared of the noncompliance or the aversions that come with it. And so one of the things that I really like to share with the audience when I go speak is how to identify some of those triggers, some of those problems that you can address before the patient even walks in. And that way, it's kind of the scenario of if I am a I'll use a zoo as an example. If I'm a vet, I don't wanna go to the zoo, walk into the tiger cage for the first time, and try to do a blood draw if my zookeepers haven't worked with them to desensitize them to me doing that. Otherwise, I'm gonna get eaten alive. And in the dental world, if you have a patient with special needs that you can't build a collaborative care approach with, caregivers or parents, siblings, whoever's working with them at home, and teach them what you need them to do, then when they come to your office twice a year for 30 minutes to do their cleaning, it is going to be a complete annihilation of the hygienist or doctor, and things don't go right. And that's where we get into um, the dependable, outcomes that come from sedation. And then we just get dependent upon sedation instead of saying, "Hey, I can't stick somebody in a hospital every time I need to brush their teeth." And it's not healthy for them, and obviously, access to care is a big issue. So, that's kind of where, my passion is and my message is, one, to empower and, help providers really understand what they're looking for because, again, it's not the teeth, they're great at teeth. We just need more work on the person behind them.
Yeah, do you is there a question that you get asked a lot? Is there, like, one or 2 particular questions that when you're out speaking,
Yeah,
just, "How do I"
the yeah, the first question's always, "Where do I start?"
Mm,
Or, "How do I start?" And so, and that's a very basic answer because, I give them my questionnaire that asks the questions that identify those triggers. And it's very simple, but you have to have more, uh, emotional empathy and skills, listening skills, um, and and that's hard for a lot of people, it's hard for me. That's not my personality, and so when I work with my special needs patients, I'm going against what my natural personality is, which is get in there, get the job done, go to the next one. I'm kinda built as the workhorse, but, when special needs comes into the office, you have to stop, kinda take a step back, and realize I may not get everything done that I usually do. I may and things may go sideways, but at the end of the day, you have to realize what you're doing is is a benefit not only to the patient, to their health, but also to the parent and caregiver. Because as a parent, the worst thing that you fear is what's going to happen to my child when I'm not here, and who's going to care for them, and can they still maintain the same level of health care when I'm gone?
Mm.
and that's a big struggle for a lot of people. So, we take our time to really educate the parents and the caregivers, answer their questions, and I always say, I treat the parents' anxiety well before I treat the patients.
Wow, that's profound. Yeah, that's and I'm sitting here thinking too as you're talking that and I coach hygienists and offices and talk about how, they're always like, "I don't have enough time to do this technology, if I have the anxious patient to do this," and I try to assure them that if you were to inform doctor that you're experiencing this with the patient and you needed more time and you had to sit there and educate and or to help desensitize the patient in some way to help them understand the procedure, whatever that is, and you never started treatment, that I feel in my heart that the doctor would be okay with that. And then it's, what do they charge, what do they code out for that day? What do they da da da? Because I'm sure you get that question all the time.
Yeah.
But there's a lot of hesitancy toward that because the hygienist, I know specifically, feels like they're gonna get in trouble.
Yeah. And I get that, I use the acronym TIM, um, which is the biggest barriers to care for patients with special needs, which is time, ignorance, and money. And, it takes longer to treat someone that has neurodiversity or neurosensitivities. Um, Again, we didn't get the training, and the ignorance part also encompasses the fact that we don't even include in our intake forms questions that would even give the patient the opportunity to let us know what their issues are ahead of
Mm.
time. And then money, it really comes down to it where, if this was something that a lot of providers, were profitable with, like Crown and Bridge or, implants, you'd see more signs that said special needs dentist, not cosmetic dentist. But and I say this as I'm a private practice business owner. I own 13 offices. I understand it. I know what profits are. I know what P&Ls are. I know what the loans that I have to pay back are. But I think we've gotten to a point in our careers and our profession where we're more focused about metrics and production than we're worried about, did the patient leave healthier, happier? Did I do a good job today?
Yeah,
You know? And I wish that model was still available, that people could obviously still, make a good living on. But, I also tell people if it was, then, you know, the government would have facilities set up, to allow us to do that. But there's a lot of reason why community health centers are what they are. Um, and I see a lot of families having to go there, and they're like, it's a miserable experience because it's not designed for people that need the extra time or the sensory safe areas, for them, to feel more comfortable in that situation, which when that doesn't happen and that's not available, all you get is avoidance, and then these people never go to the dentist. They only end up in the ER when there's a dental emergency.
yeah,
And, then you see the cycle that just never ends. There's a need, there's, no access to care, and there's no funding for it. So I had a lady come, this weekend. She was down at my neighbor's house, and, she lives up in Kansas, and she said, "I've got a 33-year-old, daughter with autism. Um, do you recommend anybody?" And I was like, I don't I don't know anybody, that, that's willing to, see your adult daughter, at this stage, unfortunately. And then, she said, "Well, can I just come see you?" And it got me to thinking, I was like, this is the level of, I guess, care parents are willing to go to. They're willing to fly and drive hours or, even spend an exorbitant amount of money just to get to someone that's willing to open their door. And I think the more that message gets out to say, "Hey, look, you know, doctor, hygienist, you wanna build your practice, you want to grow your, name in the community and, separate yourself from every other provider down the street, open your door to special needs patients, and I tell them, "Pick the slowest day of your week, pick the slowest hour of that day, and make it to where you will see a special needs patient, just 1 patient in that hour, and I guarantee you that hour will be booked out months, and then soon, every family member that knows that you're willing to treat their family member with a disability will now become your undivided, patient, devoted. They're not gonna look for anybody else. They're not gonna go price shop your cost. They're gonna say, "Man, this doctor is willing to do what nobody else is. We're gonna support him with our business as well." And that's how I've grown all of my practices, is I am willing to treat everybody of all ages, of all disabilities, and I've never had to market my practice, because families do it for me.
Mm, yeah, wow. So, when you were talking about some of the things that you use on a day-to-day basis and the what's the word that you used? There are heightened sensitivities and, sounds and things. What are some of the things that a person can do every day to become more aware of how that affects their patients? I know that you talk about this in your lectures that you provide, but what are some of the things that when there's tastes that are involved that they can't deal with that?
Yeah, I will tell you one of a good resource right now, out on Hulu is a documentary called Sensory Overload. My family and I were actually, blessed to be part of this documentary, and, it just highlights 3 different families. It highlights, the experience for not only the person with neurosensitivity or neurodiversity, but their family and how that relates to their daily ongoings, not just going to the dentist. But that's a really good thing just to kind of get yourself a different perspective
Mm,
uh, for this population. Um, I would also say there's, obviously there's educational classes out there, like mine that kind of go to an outside the box opportunity where I don't sedate any of my patients. So everything is desensitization. And it really just helps empower the providers that attend, that they can do this, and they really don't have to redesign your entire office for it. It's very simple to do. And at the end of it, it's like, what else can I learn about it? Well, like anything else, find a podcast, find an audiobook, look it up. I mean, there's so many resources out there, but unfortunately, we're kind of the if I put my head in the sand, maybe it'll just pass me by, and I don't have to be part of it, you know? And, my ultimate goal at the end of all of this is I know there's gonna be a day that I'm not here, and, my prayer is that somebody that I taught, somebody that took one of my classes, um, one of my associates, someone, would be willing and able to treat my son, as he gets older and is able to, still get into the dental office to take care of his oral health.
yeah, wow. Because I think that even with the providers that are out there, the whole topic of what you're talking about can seem overwhelming
Yeah,
because just like you, where you were averse to, "I don't wanna deal with sick people,"
yep,
it's like a whole different skill set to learn and lean into to improve yourself, to be able to meet the patient where they are on a different level, even with the day-to-day patient who doesn't have those different neuro sensitivities. I mean, just those patients are hard, and so it adds a whole not even another layer, but layers onto that.
yeah,
I think that it's not now that it's becoming more of a topic that we're all talking about and realize that the needs of our patients are more profound than we realized in previous years because there is that diagnosis, because we are more aware of things, that that it's a calling, it's a call to us, to step up, to meet them
Yeah.
and
Well,
to be
there's more than 32 teeth, with every patient that we have to, take care of. And I think in the biggest struggle for a lot of providers is, like you said, 4 years of dental school or 2 years of hygiene school, it teaches you how to be really good. But if you think about it, like they taught us one way, and it wasn't until after graduation that we realized like there's alternative ways of doing the same thing. Well, we're right there. We're in that same situation where providers have to learn how to treat someone's oral health in ways that's not standard. And that's where we're getting into minimally invasive, procedures now. There's so many materials out there and products that we can use that help families that are struggling at home with brushing, um, help providers at the office that struggle with compliance or just, keeping someone still or their mouth open. Um, and really, technology is actually also becoming, part of this transition from just standardized dentistry to, there's equipment out there, X-rays now that we can take a simple CBCT and get external bite wings, diagnostic external bite wings. There's products that with AI, that are just making things so much easier. And again, it's not just for special needs, it's for the patients that have dental anxiety that, struggle with just going, "Okay, I don't know if I trust you." Going to the dentist is kinda like speed dating. You only get to meet somebody for, like, 5, 10 minutes, and then you gotta decide if you like them, you trust them, and if you wanna do this again, So, we really have to start to lean into our technologies and our materials that are out there, and really get outside of our own boxes when it comes to, standardized dentistry.
yeah, or make it the new standard,
Make it the new standard. That is
you
correct.
know? That is so insightful. I just appreciate that you are out there educating other people about this and normalizing that it is in your everyday. And I know that you have specific topics. You want to tell the audience about the topics that you speak about?
Yeah, so, there's 4 classes that I give right now, that really kind of encompass this whole, topic. Becoming a special needs warrior, which we dive into specific special needs and the effect of that disability on their oral health. I have an inclusive dentistry class, which really kind of dives into a lot more of the personal, your from the provider standpoint. I want everybody to kind of you got to be a little more self reflective and say, hey, look, what's my personality? What's my biases towards this population? How does that affect, the way I care for my patients? And then how do I understand who they are? So that way, we can definitely get a better experience for everybody, but also how to change the environment in your office, how to schedule those patients. So it's really a complete office type class. Um, then we have, autism. I do a class just on the dual perspective of dad and dentist for autism, and that's just a deep dive into the world that we live in daily, and really some of the struggles, that families that have a child with autism deal with. So again, it just helps providers have a different perspective. And then, our newest one is the dental anxiety and depression class, which we've titled, "Nothing Personal, but I Hate You." Uh, and so, I really am looking forward to this one, because I think this is 80% of our patients have some form of dental anxiety.
Mhm.
So it applies to everybody. But it's like, what do you do when someone walks in and says, "It's nothing about you, but I just hate you." And I'm like, "Okay, well."
Good morning to you.
Yeah, good, yeah, we have become very thick-skinned in dentistry because we assume, like, yeah, everybody hates us, and so, but why, And I think some of that is going to be, learned when it says, what if we just had more conversation about why would you say that? What was your what is your anxiety? What's your worry? What are the alarms going off in your body that are making you white knuckle my chair and your heart rate go up?
Mhm.
And how's that affect you? You know, because I guarantee when you dive into those specifics that have nothing to do with teeth, the patient is going to relax and your conversation is going to change from one of trying to educate and, you know, then all you see them is walk out your door versus they are going to be a partner with you in their own oral health and instead of a combative person to your suggestions.
Yeah. Well, you guys, if you haven't seen Dr. Dent present, you're in for a treat. Everybody just eats it up. Well, Dr. Dent, thank you so much for being on today. And if you guys want to reach out to him, his information, contact information is in the show notes. If you want to schedule, you can reach out to Rare Bird Speakers to get him in front of your meetings to talk about these important topics. And I hope that you all got some insight from today. Thank you so much for being on.
Thank you, Kelly. Y'all have a great one. I appreciate the time.
Absolutely. For all of my followers, listeners, you know I always ask the favor to go on to Apple Podcast to give the Dental Handoff a 5-star rating because it's Apple Podcast that matters. And then if you're watching this on YouTube right now, if you wouldn't mind dropping in a quick comment because that's how the algorithm keeps us relevant, and go ahead and subscribe, like, and share to people who you love. Thank you so much for what you do every single day, the lives that you touch, and we will see you again next week. Be well, my friends.
Thank you.